I'm Chris Devon, and welcome to This Gay Life. Today we're going to be talking about health issues that affect lesbians and gay women. And our special guests today are from Planned Parenthood. We have Kelly Cannon, who is Public Affairs Coordinator, and we have Kate Freeman, who is an OB/GYN nurse practitioner, and they'll be helping us learn more about this. If you have children in the room and you might find this offensive, we will be talking about practicing safe sex and other things that may or may not be suitable. So if you may find that offensive, then you may need to find another channel. But if you would like the information, which is very valuable and very important for all of us to know, then please stay with us. I'd like to introduce our guests right now. This is Kelly Cannon and Kate Freeman. And why don't you tell us a little bit about yourselves, each one, and then you maybe tell us a little bit about Planned Parenthood.
Sure. My name is Kelly Cannon. I do public affairs and education for Planned Parenthood of Southwest Missouri, which means basically Joplin and Springfield and anything in between. When anything comes up on television, you see me. I go out into the community and do all kinds of education. If anyone would like to have us come and do an education on about really anything, then I would be the one that you would call, and I would be the one who would go out and do that.
And OB/GYN, OB/GYN, what exactly is that?
I'm a practitioner, and I'm an RN. I've gone back and gotten further schooling, and I'm one of the practitioners at work, and I've been there for 4 years. And I do all the exams and the counseling and the talks and all of that. So.
All the fun stuff.
Yeah. Yeah.
Okay, why don't you tell us a little bit about Planned Parenthood? Since you work in the public relations.
Sure. We are at 1412 South Glenstone, and we are a health care clinic that serves both men and women, and we also go out into the community and do as much education as we possibly can. We also have resources available in the clinic for people to come in and use. So we aren't just a clinic, we offer other things also. And our healthcare services, I think lots of times when people think Planned Parenthood, they think contraception. But we actually do much more. And I'll let Kate talk a little bit about some of the other things that we do.
As far as healthcare, what we do, of course we provide contraceptive methods to women of all ages. And we see men for STD screening. And we also do menopausal women and do hormone replacement. And then we do a wide range of just routine physicals, routine pap smears, and exams for women.
Well, a lot of people, when they think of Planned Parenthood, I know there's a lot of misconceptions. A lot of them think that they're government funded. A lot of people think that for some reason all they do is, like you said, birth control and that sort of thing. But it's really much more all the health issues.
Right.
Including the teaching. When you go out to schools and stuff, or what do you usually teach?
I do all kinds of programs. I do programs on sexuality and self-esteem. I do programs on birth control, on sexually transmitted diseases, AIDS. I have a program that is very good on talking to your children about sexuality. So I can really do about anything that deals with sexuality or an issue that is close to that.
Well, with lesbians and in general, a lot of people feel they would have no reason to go to the clinic because they don't need birth control.
Right.
Well, that's maybe not necessarily true.
No, it's not true at all. And in fact, one of the things that we're seeing right now because of that belief is an increase in the rise of cervical cancer among lesbians and an increase in the rise of breast cancer among lesbians. We are also seeing an increase in HIV and AIDS cases among lesbians and other sexually transmitted diseases also. And the reason for most of that is because lesbians don't think that they need to go to the OB/GYN or go to the clinic because they aren't going to get pregnant, so they aren't going to get the contraception, so they don't get the health care also. But the fact is that the health care is something separate, and it's something you need to have.
Kind of like maintenance on a lawnmower.
Exactly. It's exactly like maintenance on a lawnmower.
You may only use it during the summer, but you got to take care of it.
You've got to have it all the time.
Nothing crass there, really.
Right. What we like to talk about is preventative health care, and that's become, sort of a catchword right now because of all the health care reform. But that's really what we need to see. We need to see people getting preventative health care, and pap smears and breast exams are preventative health care. And if you can catch cervical cancer or breast cancer at an early stage, we can cure it. No one has to die from this.
How often should a woman be going in to get her annual checks? I mean, is it like once a year?
It should be every year.
Every year?
She should have a clinical breast exam and a pap smear done.
And how many excuses have you heard for not coming in?
A million, but we don't worry about that. When they come in, we're just saying, hey, you're here. You're past the big step. So.
Yeah, you're in the
You know,
door now.
yeah.
So that's good. That is a good sign. I think one of the things that a lot of lesbians may find intimidating is the fact of going to a clinic. I mean, even when you just go to the doctor, a lot of times it's a male doctor, and they find that a little intimidating, or they may even find it angering. One thing that I know about Planned Parenthood is that when you go in for the checkup, basically everything is taken so nicely and so easily, and every step of the way is talked to. Can you talk to us a little bit about how you go ahead and perform the like checkups and stuff? Because basically there's a lot of you explain everything, and it's really nice because you just go through step by step.
Well, I think the first thing that's nice is the chart that we have, and it does ask what your sexuality is, and I think that's very nice, because I think what a lot of women tell me is that, you know, nobody ever asked me this at my doctor's office, and I ended up making, you know, feeling very stupid, or not feeling stupid, but making them feel. And so we ask that first, and then we do all their lab work and take them in the exam room. And everything that I do when I'm doing an exam, I tell them everything at every moment. And if they can't handle it that day, they'll return. Or, yeah.
And it's not like the old days.
No.
No.
Or they take the speculum out of the ice box and
No, they're on a heating pad. And there's a lot of conversation, and there's what I think is real important is conversation and meeting somebody before they're undressed. Yeah, that's very, very important.
Well, it's kind of personal.
Right, extremely
it's
personal.
extremely.
And we also, you know, do work. In our office, we have all women. And the person who would be doing your exam will be a woman, unless you have a problem, and then you would probably see the male doctor. But otherwise, you're going to see a woman. That first visit, you're going to see a woman. And I think sometimes it's easier to have an exam from a woman. They understand a little bit more about what you're going through. They tend to explain it better. They don't just do something and surprise you. You know, they say beforehand, "I'm going to do this now. This is what you're going to feel." So nothing happens that you don't know what's going to happen. And I think for a lot of people, that's one of the things they kind of associate with pelvic exams is sort of, I don't know what's going on, and I don't like that feeling when I'm in a vulnerable position. And we try very hard to make sure that they don't feel vulnerable.
Make it as easy as possible.
Right.
Could you talk a little bit about, well, especially for lesbians and gay women, the idea of safe sex may seem a little strange, because obviously if they're not having sex with men, that they're free and they're off the hook of catching diseases.
Right. That's a very common belief. And it just isn't true. First of all, lots of lesbian women have had male partners in the past, and at that point could have been exposed to something that would hide for a very long time, such as HPV, which is the virus which causes genital warts, but also causes cervical cancer, or can cause cervical cancer. And it can hide in the body for a very long time. So that is one of the things that they need to be coming in to be checked for. Another thing that happens, what we're seeing, is a rise in other sexually transmitted diseases, because while you can pass this woman to woman, lots of people don't think you can, most of the sexually transmitted diseases. And we're seeing an increase in HIV and AIDS cases. And that's one that I think is especially frightening, you know, first of all because it's so dangerous, and secondly because lesbians do think they're safe, and they just aren't. None of us are safe anymore.
What are some ways, obviously if you have different partners or if you have a new partner, what needs to be done?
Okay. Basically what you need to remember is that any contact with the vaginal secretions could be contact with a bacteria or a virus also. So if you can put a barrier between your skin and those vaginal secretions, then that barrier will keep you from getting the virus or keep you from getting the bacteria. And some of the things that you can do that with are, first of all, dental dams. And this is a dental dam. And what you do is you just place this over the vagina. it just goes directly over the vagina, and you can use this for oral sex is mostly what they're used for. We sell these at the clinic. I think that we are probably the only place in town that you can get them, and people can just walk in off the streets and buy dental dams. They don't have to have an appointment, they don't have to be a patient, you just buy them over the counter. They're very easy. Another thing that we have right now is the new female condom, and this is it.
Yeah, they've been talking about that in the paper.
Yes,
and
they
it's
have.
brand
This has
new,
been-
and it's called Reality.
Reality is the name. I'll show you the package so that everyone knows what it looks like. This is the package for the new female condom. They're called Reality.
We're going to have a little model here that we're going to show how to use this particular female condom. But if you want to get children out of the room or anything, if you think it's going to be offensive, I would do that right now. And because it's, if you might find it offensive, basically we're technically talking about safe sex. And we're going to be showing how to put this on and how it needs to be used. So if you want the children out of the room, you better do that now. Go ahead and show us.
Sure. This is, of course, a model of the female reproductive system. And what you do is you take the female condom, and it has a ring at the top and a ring at the bottom. And this ring at the bottom is what holds it in place inside of the vagina. So you take this ring at the bottom, and you fold it in half, kind of like you would insert a diaphragm, if anyone has ever done this. Put it into the vagina and push it up sort of in back of the pubic bone until it's around the cervix, and that's what's going to hold it into place. Then you leave about 2 inches on the outside and you spread it out. And that's how it works. You can see how that fits over the outside of the vagina, and that's how it's held into place.
And does that have like lubricant on it? And
Yes, this does. This has non-oxynol 9 on it, which is a lubricant. It's also a spermicide, and it also will kill some of the bacteria which cause sexually transmitted diseases, and it helps to kill HIV. So that gives you extra protection. The other nice things about these is, if you'll notice, we had about the 2 inches on the outside that we spread out, and that is nice because it covers up a bigger area. You get that extra protection, and you can pass sexually transmitted diseases through this skin on the outside of the vagina also. So you get this extra protection.
Oh,
Specifically on the skin, another thing I wanted to add is that HPV, the virus, that is a skin virus, and that's passed through the skin. So you can just do skin-to-skin contact and have that transferred.
Really?
Yes, and that's what causes genital warts and the cervical cancer.
That's kind of scary.
Mm-hmm.
So I guess lesbians aren't as safe as they may have thought.
None of us are as safe as we may have thought. So,
You have a little brochure here, Lesbian Healthcare, that I thought was kind of neat because actually they thought about this in advance because it's actually printed up already.
Yes.
And I think that's great.
we have these
'cause,
at the clinic. And pick one up. If you just want to come in and look around, pick up a brochure, take a little tour of the clinic, that would be fine. That might make you feel more comfortable coming in for your exam.
A lot of people feel kind of funny talking about safe sex or using condoms or using dental dams. If you're going to be having a new partner and stuff, it'd probably be a good idea to be tested,
Yes.
before actually having sex, but not a lot of people do that. Any suggestions on broaching the subject? Besides just stepping into the water?
Well, really, you really just have to be able to step into the water. You know, what I always say to people is, you are going to be doing the most intimate act that you can possibly do with someone, and you're not willing to talk about that beforehand. If you're not willing to talk about that beforehand, then you're not ready to be doing it. And at this point, we are no longer talking about things that you can go and get a shot for and be okay, or take 2 weeks worth of pills for, and it's not going to affect you anymore. In some cases, we're talking about life and death, and we really have to get over that sort of being uncomfortable talking about it because it's just too important anymore.
You said that there's a rise in breast cancer and cervical cancer and several other things. I mean, besides the fact that they don't come in or women don't come in for checkups, what are some of the reasonings behind that?
The rise in breast cancer, there's probably lots of reasons. Breast cancer is going up among the general population also. We don't know exactly why. But one of the things we are seeing is it's not only going up among lesbians to the 1 in 3 level. This happens also for women who never have children and never breastfeed. So that's one of the things that we see. And cervical cancer, of course, is going up in all women who don't have regular pap smears. It's not just lesbian women.
With the breast cancer, 1 in 3.
1 in 3, yes.
That's kind of scary. I mean, that's like one of us.
Yes, that's exactly what that is. That's like one of us up here. It's extremely scary. And one of the things that we will do when you come into the clinic is give you a breast exam. And we will also, and Kate can talk a little bit more about this, teach you how to do your own breast exam monthly at home. We'll give you a little shower card and you put it up in the shower so that you remember. But it's just too important not to do.
What exactly do you need to be doing with the breast exam?
A self-breast exam?
Yeah.
Every month, about a week after your period, you should be doing a breast exam. And we have pamphlets and things that show you actual diagrams about how to do it. And we definitely know that if you do a breast exam on yourself every month, have a clinical breast exam done every year, and then after the age of 40, have a mammogram every 2 years, after 50, every 1 year, that we could prevent a lot of breast cancer and also decrease the mortality from it.
Why do you think people don't pay attention to that?
People, with anything like this, people think it's not going to happen to them.
Denial.
With anything. Denial, exactly. And sometimes people have a hard time touching themselves with the breast exam or things like that.
The biggest thing that I see is women who come in and, I see people every day, do you do your breast exam? As I'm doing their exam, I ask them that, and they'll go, well, I don't know, because I don't know what I'm looking for, and I don't know what I'm doing. And there shouldn't be a lot of fear involved. You just feel it every month. If there's a change, you need to let somebody know.
Right.
And it's very simple. And it can definitely decrease. Women find their own masses.
Yeah. Well, I mean, it's kind of your body, so you would think. Is there anything else, I mean, like changing moles or anything like that that needs to be looked for?
All of those things.
As far as with the breast exam, things that should be looked at are discoloration of the skin, a pulling in of the skin tissue, and again, in this pamphlet that we hand out, it tells you everything that you're supposed to do as far as looking in the mirror, arms above the head, arms at your waist, and one of the most specific things you should be looking for is a puckering of the skin or a pulling in, and then you do the actual breast exam where you feel.
There's a program, a lot of people will say, well, I can't afford it. I can't afford to go get an exam. And a lot of people, you just call up any gynecologist and basically you're going to pay $97 for just walking in the door.
And that's inexpensive. 97.
And that's cheap because it's like 150 in other places. And they're saying, well, there's no way I can afford that.
Right.
So
at Planned Parenthood, we charge $42 for an exam. And we have this new program that is just a wonderful program. It's called the Breast and Cervical Cancer Control Project. And what it does is you need to be a resident of Missouri and be 18 years old or older and fit into income guidelines, which I will give a couple here in a minute. And if you can qualify, which it's pretty easy to qualify for, you will get a free yearly breast exam, pap smear, pelvic exam, and if you're over 40, a mammogram. Or if you're under 40 and they find something in the breast exam that would indicate you needed a mammogram, this will pay for it also. And the income guidelines are if you have one in your family, you can make $14,720 or under and qualify for this program. 2, it's $19,680 or under and qualify for the program. And if you have a bigger family than that, you can call the clinic and get them. But as you see, $14,000 is pretty easy to qualify. There are a lot of us out there that are making $14,700
that's
and
kind
under.
of sad.
Yes.
Well, women make so much money in the workplace anyway.
Right.
Oh, yes.
Exactly. Exactly. And plus a lot of times our money goes for so many other things. We put health care last so many times when we really should be putting it first. We don't have insurance, or we can't meet our deductible on our insurance, and so we don't get our health care. And with this program, you can get health care without putting it last. You can finally put it first so that you can get the health care you need. If you are underinsured or uninsured, you can fit into this program. You can have insurance and still fit as long as the insurance doesn't cover the cancer screenings that this covers. And if you can't meet your deductible, you can probably fit into this program also. So there's just no excuse anymore for not coming in for your annual exam. Another nice thing is that if you come in for this exam, for this on the Breast and Cervical Cancer Control Project, then you're put into our system and you become one of our patients, and you are eligible to receive all of our other services. So your exam would be free, and then if you needed menopausal services, all you would have to pay for would be your medications. If you needed STD treatment, all you would have to pay for would be that, and so on and so forth.
Wow. So there's no excuse anymore.
No,
So.
there really isn't. This is a wonderful program, and they can call the clinic and ask for more specific details on it.
And one thing I must say is that any time that I've ever called the clinic, they've been at least overly helpful, to the point that they'll bend over backwards 3 times, you know, to try and help you or help you understand. And so they're really user friendly.
Yes. Yes.
Is there anything else that you'd like to say about this, like safe sex or things that need to be done?
I think we just all need to remember that we're all at risk, that no one is safe anymore, and we need to be getting the health care that will prevent our death, and this is one way to do it.
Or early death, I should
Early
say.
death, yes. Well,
You haven't learned to take care of that yet, but we're
early
getting
death,
there.
yes.
If somebody wants to call and find out about safe sex for lesbians or something, they can just call the clinic?
Just call the clinic.
Do you guys ever have any like classes or just say like?
I can go out and do programs on that. We don't really have any classes yet. If we had enough people interested, I would be happy to set something up. That would be wonderful. So sure, if people are interested in having some kind of class on lesbian health care or safe sex for lesbians, something like that, I would be glad to set the program up.
Okay.
They could also call and just set up an appointment if they'd like to come in and talk. And usually if we do something like that, it's like a $5 consult fee just for having somebody to sit down and talk with them and go over it.
Okay.
Plus they get to look at the clinic and see.
Yes.
That's really not quite that monstrous of a place. Okay, the things that I want to go over are the things most important that lesbians and gay women really need to pay attention to, because they, for whatever reason, it slips their mind very easily, would be to get your pap smears.
Yes.
And your annual breast exams, and to do your own self-exams on a regular basis, and that's 1 week after your period.
Yes.
After your period. And if you need any information on any of that, they've got pamphlets, lots of information, so you could just go hog wild on that. You might want to go ahead and put up the number and the for the clinic and the address, and that way, if you want to go ahead and get a pencil, we'll have the telephone number for you. But if there's any problem at all, I think you need to go ahead and give them a call.
Yes.
And because they're very friendly, they're very nice. And also, if you have any specific questions, like I know in each one of our lives, there always seems to tumble a little bit of a wire or something. I don't know, that has a tendency to shake up our lives. You can talk to them about that as well. There we have the information for Planned Parenthood. Go ahead and write that down, because I know you'll want to go ahead and get in contact with them. You said that you serve not only women but also men. This is kind of a question, just kind of off the top of my head. Do you serve, I mean, is there a lot of gay men that come in?
We'd say a fair amount, but most of the men that we tend to see, I think a lot of men don't realize that we do STD screening for men, so we end up seeing a lot of the partners of our patients. But we do have a fair amount of gay men coming in for treatment and diagnoses.
Well, that just blows another ship right out of the water, you know? You also said about men coming into the clinic. I mean, it's usually a pretty friendly atmosphere and stuff like that, so it's not very oppressive at all.
No, and it's such a routine thing now. They're usually going to see at least one other male in the waiting room, or if not, they'll be, you know, it's not.
So don't be too intimidated.
Oh,
right.
no.
That's all
Not
right. The nurses are nice.
Yeah.
Okay, so if you'd like any information, especially like this one, this is on lesbian health care, and I think all of us should pay attention to that and make sure that we get all of our exams as we need them. And anything else that you'd like to say?
Just please call us.
Yeah.
Okay. Well, that about wraps it up. Remember, take care of yourselves and get your exams. I know that's like tedious, I keep saying that, but it's so important, so very important. Thanks for joining us on This Gay Life. I'm Cruz Devon.